Okay, put that somewhere. Stethoscope, and we're going to have to lubricate that tube. Okay, somebody give me that unopened tube, and I'm saving something. Easy tube. Okay, so see, we got an unopened tube here, even though I'm not going to open this one. But what you want to do is you're going to open this tube, and it's going to be open. And you're going to have that one end open, that's plastic, and the tube down there. And you can take this and open it, and the plastic part that's open back that way, you can put the lubricant on there, just waiting for you to lubricate the tube, okay? So this is landing. Well, the reason I'm telling you this is not sterile, but it's clean. So you don't just lay this tube on the table. You don't lay it on this. You don't let it hit the floor, because all that stuff is dirty stuff. This is not sterile, but it is clean. So you want to leave that tube in there, put your lubricant right there, okay, and have that ready. Your hospitals have actual NG tube holder that they put on. It's sticky, and it'll hold the NG tube in. And years ago, everybody taped their tubes, and we show you how to tape it, because if you're out of those and have to put an NG tube in and they have no more in the hospital, you need to know how to tape a tube. So you're going to get a piece of tape, one piece of tape, one piece you're going to tear in the middle. You're going to do like a chevron or a Y tape. And then we're going to have a little bit of piece of tape to mark where we get our measurement. Okay, we're going to have that. Okay. Now, on the measurement of the tube, we're going to, of course, let our patient up. It says follow position, but I'll go up higher, a little higher than the actual degree says if I want to. Doesn't hurt. Okay. We're going to get our patient up. This is suction tubing that will actually be put in a suction canister and won't be falling. Okay, so we got this tube, even though it's in my hand and it's not sterile, I'm not letting it fall on the floor, it's not all over my patient's gown and all that. I'm still trying to keep it clean. Okay? And I can go put on gloves. If I don't, it's okay. But let's go ahead and put on some gloves. If you measured it without it because it's clean, I won't worry about this because you're going to have done hand hygiene. Okay, so some books will say measure from the nose to the ear, or the ear to the nose. Either one of those, because it's the same anatomical landmark. To the xiphoid process. And this is just an estimate. So I'm going to come right up in here and put a piece of tape right here. Some older nurses, like I said, they won't even put a piece of tape. They'll know that, see those two lines, they're going to push between those two lines. Just some of your older nurses will do that. Or you're going to do that too once you put in 1 million of these. Okay, and then you're going to lay that back on your pack. Don't just lay it on the bare table. And I'm saying that because I don't have a package. Okay, so we got that measured. And we finally got this patient to agree to. And now we want to know if they had any nasal surgery, if they had a tube put in before, and they haven't had any of those things happen. So we're going to check the paper for them there. I'm going to say blow on my hand. Blow. And if you feel equal air exchange on each side, you can pick your side that you want to put the NG tube down. Just in case Mr. Jones throw up, we're going to put that there. And keep his swallow, so we'll get him to hold a cup of water. They actually hold it in their hand. Okay, we already got our lubricant squeezed out. We got our stethoscope around our neck. We got our tape torn. And so now we get ready to pick up this tube, and we got lubricant on this paper. And so we're going to lube this tube up maybe a couple of inches and put a lot of lubricant on it. And since Mr. Jones can cooperate, once I start pushing this in this nair, I'm going to get him to lean his head forward. You're going to lean his head forward, and that's when we going back to the back of that area, and that's going to make him cough. And that's when we want him to start swallowing. We make him swallow, and sometimes that'll make this tube go down real easy. Now, when you insert this tube and this patient starts coughing, if they don't